The coronavirus, creeping onto the world scene only a few short months ago, and then exploding into our day-to-day lives. Every day we hear about the impact of corona and COVID-19 on, well, almost everyone. But how is it affecting disabled individuals? Today on Blind Abilities, we explore just how blind and visually impaired individuals have experienced and adapted to corona and COVID-19. We have circumnavigated the world, from Australia to Malaysia.
My name is Elise Lonsdale and I'm from Melbourne, Australia.
This is Chichao from Malaysia.
England.
Hi, my name's Steve.
Joe Fishwick.
Trinidad and Tobago.
Alan Hariho.
Canada.
Nick D'Ambrosio.
Tim McIsaac.
Japan.
Hiroyuki Shinagawa.
The United States.
Laurie Thompson. Brooklyn.
Brian Fischler.
Sherry Molengraf.
Jeff Bazer.
In our 14th episode in our series, Around the World with COVID-19 from a Blindness Perspective, we meet Hiroyuki Shinagawa from Osaka, Japan. Hiroyuki shares his perspective as a totally blind massage therapist in Osaka. Hiroyuki gives us a unique perspective not only on the progress of the coronavirus and COVID-19 in Japan, but also into the Japanese culture, societal influences, and insights into the blindness community as well. And now please welcome our guest, Hiroyuki Shinagawa.
Japan has confirmed its first case of the Wuhan virus. The man in his 30s had visited Wuhan, where the outbreak is believed to have started. Prime Minister Shinzo Abe insists that schools nationwide must close despite mounting anger.
But Mr. Abe defended his decision, saying that the coming 1 or 2 weeks were crucial. He hopes to prevent new clusters of patients among children.
Japan has over 200 confirmed cases of the virus. 4 have died.
Japan's Prime Minister Shinzo Abe is facing growing calls from the public to declare a state of emergency. This as the rapid increase in coronavirus infections brings the country's healthcare system to the brink of collapse. Japan has recorded more than 2,300 cases of domestic transmissions of the virus and 67 deaths. Infections have nearly quadrupled in 10 days.
We did hit another milestone of virus cases. Osaka as well, close to beating the capital as the nation's biggest hotspot. That's according to NHK. At least 220 new infections. Osaka seeing a huge spike now after nearly a month of seeing 0 cases.
Japan has passed the 5,000 mark, the death toll 105.
The number of new COVID-19 cases continues to rise. There are more than 11,000 cases across the country now.
This week, Japanese Prime Minister Shinzo Abe declared victory over COVID-19 in his country and declared the 7-week state of emergency now over. In total, the country has seen 858 deaths and just over 16,000 cases.
Concerns are mounting as the virus has been spreading faster than ever. In July alone, it's recorded more than 5,000 coronavirus cases, nearly half the city's total infections.
Kabuki is a traditional Japanese art form, hundreds of years old. As Tokyo's governor considered ordering a new state of emergency, the theatre is at risk of closing. COVID-19 is also a disease that primarily kills elderly people. Japan has the world's oldest population.
Hello all, my name is Hiroyuki Shinagawa. Konichiwa from Osaka, Japan. Osaka is one of 47 prefectures in Japan, surrounded by Kyoto, Kobe, Nara, and Wakayama. I'm a totally blind and working as a massage practitioner. In Japan, massage and acupuncture is a traditional job for the blind. There are many different styles of work in massage field. Some people open their own massage salon. Some works for hospitals, and some are hired by companies in the massage room. Others visit clients' houses and nursing home for the rehabilitation purposes. In Japan, new coronavirus has been in the news since the end of January. In February, the cruise ship Diamond Princess was a hot topic.
Passengers from the Diamond Princess have continued to leave the ship in Japan for a 3rd day. Everyone who tested negative for the virus should be on dry ground by tonight.
More than 700 have left the liner since their 2-week quarantine ended on Wednesday.
So far, more than 600 from the Diamond Princess have tested positive and 2 former passengers have died.
Around that time, it was getting a number of people tested positive gradually, but there were not many death cases. In March, famous Japanese comedian passed away by COVID-19. It gave a great impact to Japanese people. The state of emergency was declared in Osaka on April 7th.
Japan's Prime Minister Shinzo Abe will declare the entire country under a state of emergency. That'll last until May the 6th. The expanded declaration now would add Japan's 40 remaining prefectures. Japan's reported coronavirus infections have more than tripled since April 1st, more than 8,700.
I work in the massage room in the company. My company decided to close the massage room temporarily from that day. In our massage room, it was run by 3 therapists. We all had to stay home. Other employees of the company were also ordered to stay home. Most of them had started to work from home, but we massage people could not work from home.
For 2 months, Koichi Sei played music in his Tokyo bar with no one to listen to it. The bar was closed, not because of any official order, just government advice, and he says duty to his customers.
We cannot gamble our life.
Driven by social responsibility instead of harsh penalties, so far Japan seems to have dodged the worst of the pandemic. Even with a population 3 times Canada's, the death toll is less than an eighth, fewer than 1,000, despite delayed border closings, limited testing, and no lockdown. Avoid the 3 C's: no closed spaces, no crowds, and no close contact. Since Japan realizes it can't kill the virus, it's decided to focus on containing it.
From the beginning, we have the sort of an understanding that we are living with coronavirus.
Another key element is targeted contact tracing instead of mass testing through some 800 local health centers across the country.
It was a time of self-isolated. Actually, there were no penalties in Japan. It was just a voluntary quarantine. We are required stay home, don't go out to other prefectures, and library and movie theaters were ordered to close. Restaurants and bars should be closed at 8 p.m. Yeah, it's so early. Massage places were able to open, but many clients were discouraged from coming and receiving the massage. Also, the therapists who visit and give the massage at home were restricted entering facilities. The state of emergency was lifted in Osaka on May 22nd, but my staying at home continued until June 21st. So now let me introduce you what we are doing in the massage room to prevent the infection. Before receiving the massage, clients needed to take a body temperature, and we use disposable sheets instead of linen. And after the massage, we wipe the bed, mat, and dressing cage with alcohol-laced paper. During the emergency situations, there seemed to be few people walking on the sidewalk. So in the town, it was quiet. Sounds and noises might be the clue when blind people walk around. My friend told me it was difficult to find the places and walk around by himself. Even at busy train station, there was no crowds, so he couldn't catch any sound from the ticket gauges, no footsteps, no conversations. In such cases, Be My Eyes Up was so helpful. There is one welfare services for the blind and visually impaired people. It's accompanying assistant service. Many people use that service when they go to hospitals, shopping, or concert halls. But after the pandemic, many blind people don't feel free using that service and going out because many helpers refuse to go out for the fear of infection. On the other hand, there are also many blind people who don't want to go out with the same reason. I heard that income of helpers' office is decreasing and facing business difficulties. When I go somewhere, I walk by myself with a white cane. It's a good exercise for me, but staying at home, I lost that valuable time. So I had tried to run and stretching in my room. There were so many kind of people who uploaded videos of yoga and stretching with voice guidance for the blind people on YouTube. Now I'm missing the time to go to the gym. I used to go to the gym for the disabled for the swimming once a week, but now I cannot make a time to go there. Before pandemic, that gym was open until 9 p.m. so I could go there after the work. Now, they close at 5 p.m. Also, we are required to apply a week in advance and have to be selected in the lottery. Oh, my fat. I cannot burn off the fat on my belly. Well, what is the situation right now? 2 months ago, in the morning time, anyone can have a seat on a commuter train, but now full of people standing. And evening trains are so crowded more than before because many people would like to go home earlier. Nobody go to karaoke bars. So in daily life, what I'm taking care for, wearing mask, keeping social distance, and washing my hands. I think the most important thing is not to touch my face by my fingers. Also, Japanese government give us advices to avoid 3 C's. 3 C's are closed spaces, crowded places, close contact settings. Okay, next let's talk about mask. Do you like wearing mask? I don't like it, definitely. In the summertime, it made me so hot. Not feel free going out with mask. If you come to Japan, you can see a lot of people wearing mask. Most of people don't hesitate to wear the mask. Do you know why? There is a big reason. In Japan, especially in the springtime, in February, March, April, it's increasing a lot of people who are annoyed from the pollenosis. The mask is a good tool, not for breathing in pollen of Japan cedar and cypress. So it became one of Japanese cultures now. By the way, Osaka is one of popular places for the tourists. Before February, I could hear many foreign languages at subway stations, mainly Chinese. But now, no chance to hear it. Do you remember? The opening ceremony of Olympic Games was scheduled on July 24th, 2020. As you know, the Olympic and Paralympic Games have been postponed next year. Since middle of July, we are seeing the increase of positive cases in Tokyo. Also in Osaka, actually last week, the highest number was reported. I wonder what the world will be next year. So everybody, stay healthy and wealthy. Arigato.
Good evening. This is Newswatch 9 for Thursday, July 30th. In Tokyo, 367 new cases of the coronavirus infection have been confirmed so far today. Tokyo Governor Koike says the metropolitan government will ask restaurants and karaoke bars that serve alcohol to shorten their hours. The domestic daily number of new cases has surpassed 1,000 for 2 days in a row, raising calls for the government to respond quickly. Tokyo reported 367 new cases today, the highest daily number so far. The number of people who visited PCR testing centres is increasing. This is a PCR testing centre in Tokyo's Kita ward. The centre takes samples from people referred by clinics of other institutions. The centre was commissioned by the municipal government and the Medical Association.
We would like to thank Hiroyuki for his report on the coronavirus and COVID-19 from Japan. It was great hearing his perspective and unique insights into a country and culture and a blindness community from which we don't normally hear in the Western world. Be sure to listen to more episodes in our series, Around the World with COVID-19 from a Blindness Perspective. And from all of us here at Blind Abilities, through these challenging times, to you, your family, and friends, stay well, stay informed, and stay strong. Thank you so much for listening, and have a great day.
When we share
what we see through each other's eyes, we can then begin to bridge the gap between the limited expectations and the reality
of blind ability.
The realities of blind abilities.
For more podcasts with a blindness perspective, check us out on the web at www.blindabilities.com, on Twitter at blindabilities, download our app from the App Store, blindabilities, that's 2 words, or send us an email at info@blindabilities.com. Thanks for listening.